Menteri Ramba ke jylla ukan rat ki sangma ulong ba ke jingdon kilong kimi ki bala khlat kha khlung ni ke maternal mortality rate infant mortality rate ha ke jylla ke dei namar ke jingduna kayo ke kot bat ke kot ke khiah ukan rat ulong ba ke dau jo ke jingiap kilong kimi kalong namar 10% ki bala lek kha khon ki dei badang ret ka kerta lai phosnem ki dei ki ba kha khon palat lai sin ha ka kerta ba po lai phosnem ba donru ki khep balalap bagi don ki badang khat khandai snem ki ulayo khon hado laingun ulong bana kaliang ke sarkar kala sim ye kilat ban penduna ke jingiap kilong kmi bakha khon o menteri ramba la pentip ya kane haba jubab ya ke jingpen sngo balawan ra du MLA ka congress namau sanram uba HM shangpleng ha ke dorbar mta sngi kat kum ke jinga tho konrat ke jingdon kilong kmi bakhlat haba kha khon kalong house nam arja khatsan arspa khatwengut arja khandriu shispa khandai prangut arja khatnyo shispa khandai phinyongut shispa andri pusangut house nam arja khat phra shispa nyok pusangut hau arja khat khandai but house nam arja arpho hadu mata ki don ripo wengut ki bala klan kadba naki klung ki bahapo shisnam ulai thu house nam arja khat san ki don 8000 san spa lai pho 8000 sa spa arphnyo house nam arja khandriu 8000 san spa khat ar house nam arja khatnyo 8000 nyok pusau house nam arja khat phra 8000 sanspa nyopusau hau arja khat khandai bat mentau snam gidon praspa prap khandai hadu menta ulai thup ana kalyang ke world bank kala manjur ban ai laispa san folklore sya ke jylla na benta ban kentiu bat ban pha ke jingtrikam haboro ki primary health center community health center sub center habai dei ba ke jingkiu sya ka khandai spa ngut ki bala khlat na du bana yayong hadu naitung mentau snam na kaliang menteri rangba ulong ba ketanat ka koit ke khiah kamla shu ban phai khmat namar ka jingwan joka khlam covid kat khandai bat kiwe ki daw.
Honorable Deputy Speaker, sir, I am greatly shocked to learn that during the pandemic period, that is April to July 2020, there has been a sharp increase in the death of pregnant mothers and infants. This shocking revelation made by the Director of the Health Services that 61 pregnant women and 877 newborns have died in Meghalaya in the 4 months starting from April 20 due to lack of medical attention, for want of admission to hospitals, fear of being admitted to hospitals, and mainly because of the diversion of the health machinery to fight COVID-19 pandemic. So this goes to prove that the maternal mortality rate and the infant mortality rate in Meghalaya is increasing day by day without any efforts made by the government to intervene. Interestingly, the Commissioner and Secretary Health rather contested the statement that the data of the Director of Health Services on the strikingly high rate of infant and the maternal mortality by saying that the main cause of the mortality rate is related to socio-cultural issues, which caused a lot of resentment amongst the medical fraternity. He also stated that being a matrilineal society, women in Meghalaya face barriers in terms of making the right choices insofar as reproductive rights are concerned. But, Mr. Deputy Speaker, sir, the reality on the ground is that pregnant women and infants are still victims of poor medical attention, lack of institutional delivery, and poor postnatal care of mothers and their babies. It is sad to note that though we are in the 21st century, health care for pregnant mothers and the babies in our state is still a matter of serious concern. It may be also noted that due to the corona pandemic, many government programs like immunization, regular prenatal and postnatal examination scams have taken a backseat. Sir, recently during the Garo Hills tour of the Women Empowerment Committee, where I am also a member, it was reported that there are so many deficiencies in the hospitals all over the Garo Hills. In the southwest Garo Hills, the number of reported cases of infant mortality is 89 between the months of April to September 2020, and that of the pregnant mother is 4. So the committee, during its tour to the southwest Khasi Hills in Maukarwat, was informed that between the months of April to August, there has been 48 cases of infant deaths and 5 cases of maternal deaths. So examples of these 2 districts are sufficient to confirm to the total figure of 877 infant deaths and 61 maternal deaths in just 4 months all over the state. Honorable Deputy Speaker, sir, the government need to immediately stop these deaths and address this sensitive issue at any cost. We cannot afford to be just mere spectators of such tragedies happening in front of our eyes. According to the DHS, most of the women died because they were not admitted to hospitals or health centers for institutional delivery. The newborn deaths were due to the lack of medical attention, pneumonia, birth asphyxia, and prenatal and postnatal care. Sir, the state has an infant mortality rate of 34 deaths per 1,000 live births, and pneumonia is the major cause of death of the babies at birth. Interestingly, Southwest Garo Hills has more cases of babies dying due to hypothermia. Therefore, while looking at the healthcare scenario in the state, there is a complete failure of the health department to provide even reasonable healthcare services to the people. A premier hospital like the Ganesh Das Hospital in the state capital also lacks infrastructures, equipments, then the incentive care units for babies, shortage of beds. Recently, during the pandemic, a pregnant woman was denied admission due to shortage of beds, resulting in the death of the baby. Many MCH hospitals constructed all over the state under the NHM are still not functional due to the lack of doctors, nurses, and equipment. These buildings are already leaking and all the glass panes are broken. It is really sad to see the way the health department is handling this matter. One mother.
I would, at the very outset, like to thank the honorable members, especially the honorable member for Mausangram, Shri H.M. Champliang, who has raised a short duration discussion under Rule 50 of the Rules of Procedure and Conduct of Business regarding the news item which appeared in the Highland Post dated 29th August 2020 under the caption, quote, "State records over 900 deaths of infants and pregnant women in April to July," unquote. Sir, I would also like to take this opportunity to thank the Honorable members, namely Srimati Amperin Lingto, Honorable Member from Limukra, Shri Merylbon, Honorable Member from Nongpo, Shri P.T. Sokme, Honorable Member from Maulai, Shri George Lingdo, Honorable MLA from Umroi constituency. I hope I've covered all. Thank you to all the members who have participated and given their suggestions on this very, very important discussion, I should say. So at the very outset, I would like to state that this is a very important issue. There is no doubt about it. It's a very, very important and an issue that needs to be addressed from all aspects, as has been mentioned by the honorable members. So the issue of infant mortality and maternal mortality is something that is not just a health issue. We have to realize that this is a problem that has many aspects linked to it. Health is one part of it. There is a social aspect to this entire thing. There is an economic aspect. And in fact, in general, there is an aspect of empowerment of women overall, which has to be seen into this. And I will elaborate more on this as I go along, but I would like to stress that this is a very important issue. So let me just go through some numbers just to give an idea to people what we are looking at. So the maternal deaths in 2015 was 211. In the year 2016-17 was 198. In 2017-18, this is of course MMR, sir. 2017, it was 197. In 2018, it was 164. And in 2019, it was 174. And as we speak, the latest numbers that I have stand at 61. Similarly, when it comes to infant deaths, which is 0 to 12 months, 2015 was 2,513. 2016 was 2,427. 2017 was 2,512. 2018 was 2,074. 2019 was 2,524. And as of now, the current data that I have, at least from April to July, is 889. So what I'm trying to get at and trying to make House understand is that this has been a trend in our state which is very, very sad and should not have happened. We have consistently seen that we have had approximately 190 deaths in maternal deaths and consistently seen 2,500 deaths in children. This has been consistent for the past 5 years. Just to give an idea to everybody that we are looking at a trend. That's my first point, sir. So second point which I would like to make is that when you see this caption that appeared in the Highland Post, state records over 900 deaths of infants and pregnant women in April and July. Sir, I'm not trying to undermine the importance of this issue. It's a very important issue. But I would like to just give the perspective of what the health department was also trying to communicate to the people, which is that we are sitting here and we talk about COVID every day, and we have meetings every day on COVID, which is a very, very important aspect. And the fact that close to 100 people have lost their lives in COVID, what the DHS was also trying to communicate to the people was that whereas we are so concerned about COVID, which we should be, there are also 900 mothers and children who are dying. So is our attention too much on COVID? And are we looking at COVID in a different manner and not realizing that there are many other reasons for deaths that are there, and that children and mother are also dying? And I think this comparison is what the DHS, I think, when he gave this particular statement, he was also trying to bring this perspective into the picture, that there are many other issues also that we should be worried. And today, as we go along, we are seeing that we are, as a society, accepting what COVID is. We are moving forward with the challenges that we face, keeping our safety measures in mind, keeping our social distancing, mask wearing, hand hygiene in mind, and realizing that we have to move on. And though COVID was a new virus at that point in time, we were very scared. But there were other reasons why people were losing more lives. And therefore, it was just, I guess, a message to really compare in a way that we need to think about all the aspects of health in the states. So just wanted to give the perspective from that point of view. So coming to mother and maternal deaths and the infant mortality deaths. So in the year 2019, as a government, of course, we had been looking at all the data for a very, very long time. But then we came out with an actual program. And we called it the Measurable Outcomes in Transforming Health Sector through a Holistic Approach with Focus on Women's Empowerment. And we called it the Mother Program. And Mother is, of course, an acronym, but it also is very appropriate because it deals with mothers. And Mr. Chairman, sir, with that program in mind, we started looking at the institutional deliveries in one particular district. What we started doing was we started using technology to monitor all the pregnant mothers. So in Southwest Garo Hills in Ampatti, we started this program where at that point in time, we had an institutional delivery of approximately 50%, could be plus minus. We started with that. And then we started mapping every single mother. We started mapping on when is she going to expect to deliver. We started mapping who are the high-risk mothers. We went down to micro details of mapping who is the doctor who is giving her medical attention, who is the ASHA worker, who are the other medical officers who are taking care of her, who is the closest ambulance driver to her, her husband's number, her parents' numbers. All this information was tracked. And after that, we even went to the extent of going and seeing which are the auto drivers who happen to be within 2-3 kilometers of vicinity in case the ambulance cannot come in. And this mother app kept a track of those auto drivers also. So this program called the Mother App program was done specifically to ensure that we are able to track every mother. We know exactly who are the high-risk ones, and a continuous monitoring from the ASHAs, from the medical officers, doctors, from the nurses was being done, and these mothers were being tracked, and they were being encouraged to come to institutions for delivery. And at the same time, we were able to look at the high-risk ones, which ensured that we made sure that we gave special attention to these mothers who were of high risk. And I'm happy to inform you that within 6 to approximately 8 months, we were able to touch 80% in terms of institutional delivery in Southwest Garo Hills. This is the mother program that we had, and it was a pilot project, and it showed the results. And after seeing the success of this program, we then opened it up to the whole state. So last few months, we have been now encouraging the health department and the deputy commissioners and the district medical health officers to ensure that they register every single mother who is pregnant and expecting We are trying to also ensure that we get all the data, including the high-risk mothers who are there, because those are the ones who have a higher chance of losing their lives while delivering. So the high-risk mothers are very important, and now we have started expanding it throughout the state. And I'm sure that as we move along, as we start monitoring the mothers, I'm sure we will be able to bring down the maternal mortality rate to a large extent. Let me tell you, sir, the benefit of this, small benefit at least when it comes to me and the Honorable Health Minister, that now we don't have review meetings to check on the data that is coming in. This data and this mother app report is available on my mobile phone. I can at any given time tell you how many pregnant mothers are there, how many are expecting to deliver next week. Of course, these are things that we cannot be 100% sure because it depends on every individual. But roughly we have an idea of who is going to deliver and who are the high-risk mothers on my fingertips. And I can actually get a printout of the data for every district, and I simply send an email to their DCs asking them what is the status of this. I don't have a review to see the numbers. I see the numbers and I ask the questions to the district medical health officers and the deputy commissioners. So this is how technology today is helping us to gather the relevant information. Secondly, sir, when it comes to this mother app, as I was mentioning in my opening remarks, that health and the health of the mother and the child is not just a health issue. It is a socio-economic and health issue, three things together. And realizing this, now let me tell you why this is also important, sir. When it comes to the deaths in the mother, the maternal mortality, now we have been reviewing this every week. I want to repeat, every week these numbers are reviewed. Sometimes I am there, but in case I am not there, the Commissioner Secretary reviews this every week. And we've seen a trend. We saw a trend that showed that over 10% of the deliveries are teenage pregnancies. 10%. Over 30% are deliveries which are more than the third delivery below the age of 30. That means before a woman turns 30, she's already got her third child. We also came to understand that 40% of the deliveries or pregnancies, I should say, are unintended and unwarranted pregnancies. So we can clearly see that these trends are emerging, and we're realizing the importance of taking certain measures in certain areas, which will help the mothers and decrease this. So therefore, realizing all these aspects, we felt strongly that we must connect the nutrition program, we must connect the mother's health program, and we must connect the economic empowerment program through CNRD or through self-help groups together to be able to see an actual difference in the long run, not just a short-run difference of just seeing few numbers come down. It is a long, drawn affair. There has to be interventions at different levels. Another reason why we're saying this is because there is no spacing between the births of children. And if you look at the entire process, that a lot of these deaths that occur is because of multi-gravida, and lack of spacing between the children that are born is actually missing. And women have actually no right, in the sense that there is no defined policy and no discussion in society to talk about the spacing between two children. And medical professionals will tell you that it is most probably one of the most important aspects. So we need to look at all of these aspects. And therefore, as I said, we combined social welfare, which is nutrition, we combined health, and we combined rural development, including self-help group movement, in one platform, and this is what we're calling the Mother Program. And so we will see that as we move along in this project, that we will look at the mother's health, not just when she's giving delivery, but as soon as she gets pregnant. Not just when she gets pregnant, but even before that, to plan out the spacing of the pregnancy. And we realize that this can only be done if we make the women in the rural areas more economically engaged in different activities. if we are able to provide in a very safe manner different kind of birth control. So these are the issues that we're dealing with. So when we look at just the number of deaths that's taking place in maternal death, I think we're looking at the last point, which is really not fair. We need to see the entire spectrum of activities, and interventions need to be made at every step along the way. And that, Mr. Deputy Speaker, sir, is the only way to address this issue in the long run. And this mother app is what is going to allow us to do that. So I'm sorry to open this mask, I can't breathe properly. So therefore, sir, we are seeing that a lot of these regular meetings are taking place by the Commissioner and at my level also. Just to give you some idea, sir, of certain clinical interventions that we're doing in order to ensure that we give the necessary services to the pregnant mothers. I'll just give a few, sir, because I think it's appropriate that the House is made aware of these. So medicines like oxytocin, which are important in postpartum bleeding, is being delivered at sub-center levels now to avoid maternal deaths. Misoprostol is being supplied to Ashas to help mothers deliver at home to reduce hemorrhage, etc. Regulated levels of antibiotics are being administered for the neonates to avoid pneumonia-related deaths. Use of low-cost interventions such as kangaroo mother care, KMC, yields a 51% reduction in mortality for newborns weighing less than 2 kgs. This is being advised at all delivery points. So like that, sir, we are doing many such programs, and we're ensuring that interventions take place at the time when the delivery is there, so that we can reduce the risks that are there to the mothers. From the socio-economic point of view, major issues in maternal and child health, unlike most of us think, is the socio-economic issues. Multigravida and lack of spacing, which I was mentioning earlier, has been identified as the main reason for high mortality. Of the total pregnancies in the state, on an average, 40% of the mothers are either having more than 3 children or pregnant at the age of 16 or even 18 or even lesser. This means that there are high number of pregnancies which are not safe for the mother or the child. There have been cases where mothers as young as 19 have 3 children with absolutely no birth spacing. Every woman should have the right to birth spacing and a say of having a child. And unfortunately, there has not been any active discussion or conversation on this particular issue. But we are trying to initiate that. And the health policy that we're going to come out with, we have been having many meetings regarding that. The health policies will have a special focus on the mother and child's health, sir. Sir, apart from that, sir, a lot of discussion was done on the overall infrastructures that is there in the state, or I should say that is not there in the state, in the different medical facilities that we have. And this, in fact, because we started this entire program of MMR and IMR through this mother app, we realized the shortage of the infrastructure and the manpower, both at the grassroots level. So let me also, it's not about blaming anybody, sir. I think it's important to understand that, as I think Honorable Member Mrs. Amperin had mentioned, that it is a big challenge. It's not that it's something that we can expect that we will start today and we'll see the difference tomorrow. Of course, there will be some short-term processes and gains we will see. But as I said, my entire opening remarks have mentioned and shown to you exactly how complicated this process is. And it will require interventions at different levels. So therefore, infrastructure was one part that we did realize. And that's why as early as 2018, we started moving for externally aided project through the World Bank to get funds to improve the overall infrastructure in the public health centers, community health centers, and the sub-centers. And I'm happy to inform you, sir, that the World Bank has approved that project. An approximate amount of 350 crores has been approved by the World Bank and the Department of Economic Affairs, Government of India, where they will be invested in the overall health infrastructure. So we will see an improvement in the existing infrastructures in the PHCs, CHCs, sub-centers, and we will also see a lot of investment being made in the data that we get. As I said, data is very, very crucial for us. You will not believe that up till now that we started this mother program, we did not have accurate data of the number of pregnant women and the children throughout the state before this app was brought in. Now, after we've made it compulsory for them to register every single pregnancy, we are finally getting accurate data. So data is very important for us to be able to really plan our policies and interventions in the long run and the short run too. So therefore, this World Bank project will also involve investment in the IT system, where we should be having not only the record of all the patients and the history, medical history, which of course is confidential and will be available only to specific users, but we will also be having facilities for telemedicine through the system, and for diagnosis to be able to be done at the sub-center and the PHC, CHC level, at least to some extent. So our endeavor through this project will be to improve the overall infrastructure in the different health centers, not just basic infrastructure, but even the technology infrastructure that we will put in. So this World Bank project will be a key game changer, we feel strongly, that is going to be ensuring that the overall improvement takes place. Will it change everything? It will not, sir, because it's a massive, massive investment. The House should know that there are certain PHCs, CHCs which have not been repaired for the past 25 years, not even once. You have to also realize that there are sub-centers which are no longer sub-centers. They are animal sheds, where simply animals are being kept. And this is the fact of the matter. And it is very sad to see. And that is the reason why we decided that a strong intervention will be required. And it will happen, and we're going to start this particular process this year itself. In fact, the department, as we speak, they have already prepared the different estimates and the BOQs for the different locations. And now the improvement may not be in one go, but in a phase-wise manner. We will see the PHCs, CHCs, and then the intervention into the sub-centers will also follow with that, sir. Sir, coming back to also the children that we have seen, there has been a huge push from our side to ensure that the overall health of children also improve. That is why the mother app that we have is not only going to focus on the mothers who are pregnant, but it will also focus on the children who are born up to the age from 0 to 5, so that we follow the 1,000 days and beyond that also, in terms of whether the immunization is being given to them on time or not, whether they're getting the different kind of nutrition programs or not, how many of them have got a deficiency in weight or in height. So those data also will be collected through this program. And I'm happy to tell you that because of this concerted effort of this program of ours, which we call the Mother Program, just about a year and a half back, we were the lowest in terms of immunization in the country. The lowest, at the bottom. But today, we are number 2 ranked in the country today in terms of immunization. This is all because of the kind of concerted effort that the health department has been putting in, and the information that we've been collecting, monitoring, and following up. And we are seeing results. So as I said, sir, we will see results as it comes, but it is a huge step for us to look at. And I mean, there are many things to be done, sir. So coming to teenage pregnancy, sir. And I think the honorable members have really raised a very important issue out here. Now, this is where, again, it's a big picture that we have to look at. Now, why is teenage pregnancy happening? One has to understand. And obviously, it's because of socio-economic conditions in the rural areas as well as in the towns. Now, here we have a system and this huge population of close to 20 lakh children who are below the age of 18 today. 20 lakh. And they just are not being able to get the direction which they want to go to. Yes, the parents are doing their part, the children are doing their part, their friends are there, but social media and the internet also has a very, very important role to play. Now, because of the system that we're having now in terms of the huge access to the internet, sometimes our young generation is not able to really choose one from the other, and they do get impacted. They see what kind of opportunities are there in other parts, and what kind of different avenues that the youths get, and they sometimes get discouraged, and this could be one of the reasons why they get diverted into the wrong things in life, and they have different kind of social issues that come up. So therefore we realize that the youth policy is a very, very important part of this.